Bismillahirrahmanirrahim. Hi everyone. In this video we're going to talk about the how to present the results of the study that you are talking about. Very briefly, it's pretty much a standard. So in most of the study types, including the most common one that's usually presented in journal clubs, the randomized controlled trials, they usually present the data and the results in a very standardized way. There is certain tables and charts that usually are there. So make sure, I suggest that you show your audience the results one by one in clear slides, and then you just ask them to take maybe like 30 seconds or a minute and examine these results, these tables, these charts, and then have a discussion. What are the observations? What did you guys notice? What did you guys want to talk about? Again, these results are usually standardized. So for example, the consort diagram here is one of or the flow chart or the flow diagram is pretty much standard. It just tells the story of looking and screening the patients for the study, and then the randomizations, how many patients were randomized and how many patients are in each group, and then what happened to these patients or study population, what happened to them after randomization, how many of them were excluded, how many of them left the study, for example, and maybe why. So that's a flow chart. Again, just have the audience look at it and see if there's anything that they noticed. If they notice that there's a really large number of patients who left certain group, the question that usually arises is there a specific characteristic about these patients who left, these kind of things. So again, the table 1 is also a standardized table. It talks about the characteristics of patient at baseline in each group. This is an important table. Usually in randomized controlled trials, you expect both arms of the study, both groups, to be almost equal in most of the things or characteristics that the researchers detected or were looking for. Make sure that the table is clear for the audience to read, because one issue that I noticed is sometimes if you put a large table in a small slide, then it's really hard for the audience to see the exact numbers and read it. So for example, here I have to kind of divide the table into 2 slides so that it will be clear for them to read it, and then they can look into the numbers. I think that's important because you really want your audience to be engaged, and if they cannot read the slide well, they're not going to be engaged, right? So again, give them some time, see if there's any group that are not really equal for some reasons in both groups, and see if actually this patient population meet or are similar to the patient that you're taking care of in your daily practice, to try to figure out, if the results of the study really applies, if the results apply to you or your practice. This is the second part of the table. So again, I did some cutting and pasting to kind of make it look like as if it's one table, but it's or 2 tables, but it's actually one. But again, just to make it clear for the audience so that they can read the numbers and read for themselves. And then table 2 is usually about the results and whether the primary endpoint and the secondary endpoint, where there's any difference in these two, between the two groups, right? So again, give them these results, make it clear, have them go through it, maybe highlight the important results that you think are important. Of course, the primary endpoint and the secondary endpoint would be important, but also do some comments on the other components of the composite endpoint if they did the composite endpoint in their research, and then stir up some discussion about what do you guys think about this. If the primary endpoint was driven by certain component compared to the other, and so forth, and so on and so forth. That's table 2. Again, it's also gonna show the primary and secondary endpoint. Again, I have to divide the table into 2 so that it can be clear and for the audience to read the numbers. Figures are important too. They're very visually appealing. So include all the figures that they had in the results, whether that be in the actual publication or in the supplementary or supplements that they have for each paper, and then give them some time to look at it and ask them if they have any particular observations that maybe the researcher did not talk about during their discussion of their paper. The subgroup analysis is also relatively standard, so also present that. Here's a little bit too crowded, I have to admit. If you can divide this one into two, that would also be nice. And then the adverse effects also usually presented. So if that's was done in table form or graph form or whatever format that they had, presented to the audience, and again the same thing, ask them for their comments. So it's pretty much a standard. Again, make your slides clear, nice to read and easy to read. Put most or all of the tables, put most or all of the diagrams. Ask your audience and try to stir out some discussion that maybe was not actually talked about in the discussion section of the original paper. All right, very good. Only one video left. See you there.